Hello everyone, my name is Dr. Bukhari. Today we'll discuss about a common antibiotic called azithromycin. We use azithromycin in a lot of patient population, and most of us we know about common uses of azithromycin. So I'll not go into the detail of the uses. So basically, this antibiotic binds to 50S ribosomal subunit and inhibit RNA-dependent protein synthesis at chain elongation step. So basically, azithromycin is inhibiting protein synthesis. So that's the mechanism. Because we use azithromycin all the time, so we should be aware about the common side effects related to this medication. So on the top of the list, it can cause cardiac conduction abnormalities. Cardiac conduction abnormalities. So there are certain patient population which are at high risk of developing cardiac conduction abnormalities. So old patients who have a history of underlying cardiovascular disease, who have a history of prolonged QT. So if their baseline QT is greater than 500 millisecond, if they are taking the medication which can prolong QT, if they have electrolyte abnormalities like low potassium and magnesium, so these are the patients who are at high risk of developing conduction abnormalities if you give them azithromycin. So if your patient have these risk factors, you should always get baseline EKG, check the electrolytes, and try to stop the medication if you can, which can prolong QT. So these are the common conduction abnormalities which can happen if you prescribe your patient azithromycin. The second common side effect, it can cause C. diff infection. So what are the risk factors of C. diff infection? So longer duration of antibiotic. If the patients are immunosuppressed, if they are taking chemo, if they are old patients, if they have history of GI surgery, if they are taking medication like PPI, which will suppress the acid, H2 blocker medication. So these are the common side effects. So these are the risk factors which increases the risk of C. diff infection if you prescribe them azithromycin. The other common GI side effects are diarrhea, nausea, abdominal pain, dyspepsia, gastritis. So these are the common GI side effects related to azithromycin. It increases the risk of C. diff infection in a specific population, and then the other GI side effects. Azithromycin can also cause liver injury. It can increase the risk of cholestatic hepatitis and hepatocellular hepatitis. So onset of injury usually happen in 1 to 3 weeks after you start azithromycin. And risk factor is if your patient has history of underlying chronic liver disease. or if they are alcoholic, if they have history of hep C. So azithromycin can cause hepatocellular and cholestatic liver pattern. It is also ototoxic. It can affect hearing. It can cause hearing loss and tinnitus. It can cause hearing loss and tinnitus. And last but not the least, sometimes it can cause hypersensitivity reactions, which can be immediate or delayed. So these are the common side effects you should keep in mind if you prescribe your patient with azithromycin. Thank you very much. Have a nice day.